Hello, my name is Lopez Fernandez. I'm from Monash University and the Turning Point. And today I'm presenting the following keynote video. How can internet and mobile phone addiction be researched in health sciences? For doing this, the key questions are the following. How did the scholars and clinicians arrive at a consensus for internet and mobile phone addiction? How these problems have been tackled from a health research perspective? What are the proposed components underlying these addictions, and what instruments are used to estimate the prevalence? How are diagnosis and treatments managed, and users, and what are their profiles? And finally, how could these addictions be prevented? Is there any policy option? Let's start with this first slide, where you can see an umbrella. This is because internet addiction has been considered an umbrella term which covers a spectrum of other addictive problems through the technologies. Basically, the most important ones are nowadays social media addiction, online gambling, cyber sex, and recently the most important one, which has been recognized by health organizations, is gaming addiction. Then, before starting to talk about these problems, we need to talk about the data that we have nowadays, statistics and bibliometric productivity, which is the number of publications per year. First of all, please see this first graph or figure. Here we have the number of people who is using internet from 2001 to 2017, in other words, during the last 2 decades, 21st century, and you will see that the number of people using the internet has been increasing, showing a linear regression, which means that it seems that will continue growing in the following years. However, if you look down these other three figures, the first one is about internet addiction, the umbrella term. The second one is one specific internet addiction problem, which is gaming addiction. And finally, the last one is another of the most relevant specific addiction problems, disordered social networking. And I wanted to show you that all of them, as the number of users on the internet, are showing a similar pattern. In other words, internet addiction is growing in the number of publications between 1995 and 2017. Same thing for gaming addiction, but differently, because look that internet addiction has a regular pattern of growth, while gaming addiction had a pattern that was not so regular until the last decade, this last 10 years, from 2010, above all 2013, until almost the present, is when the number of publications has really grown very quickly. And finally, in social networking, addictive problem, we can see that the pattern is growing, but not so clearly as in the internet addiction, and differently comparing with gaming addiction, because here the number of publications were growing from 2007 and 2008. What are the years that Facebook was in our lives? This information has been extracted from several databases and from the International Technologies Unit from Geneva, Switzerland, with their permission, of course, and are included in this ebook that we did and is freely available for you, which was a compendium of a special issue that we ran with IJERP, the International Journal of Environmental Research and Public Health, about internet and mobile phone addiction from the health and educational perspective. Then, from this ebook, we also extracted the following. One of the papers from Spanish authors Carbonell et al. In 2018 was showing us a follow-up study about another problem considered part of the internet addiction, which is the problematic mobile phone use or mobile phone addiction. what they were observing is that from 2006 until 2017, in other words, in the last 10 years, it seems that the pattern of growth is not linear at all regarding this perception of the mobile phone dependency. Why? Because at the beginning, the self-perception of the problems with the phones was quite low, but in 2013 there was a change in Spain, observing a big number of persons showing problems. I had to tell you that probably this is explained because we moved from the old cell phones to the smartphones with the internet in our phones. And then look what is very, very interesting. After this high peak, the number of self-perceived problems with the mobile phone was being reduced and is showing not a linear, it's showing a quadratic relationship, which means that maybe these problems are high when they emerge as an innovation in our lives, but later people knows how to manage them and are not so problematic. Another work that we did about the measurement invariance of the short version of the problematic mobile phone use questionnaire across 8 languages was showing you that there are good questionnaires like these ones that could be used for measuring this kind of addiction problem, and these are the type of items that we usually use to talk about mobile phone addiction. Then, just to see a bit of the evolution of these new internet use related addiction problems, what I can tell you here is that during the last 13 years, above all the last 20 years, we have observed a quick evolution of the knowledge that we have nowadays about these new addiction problems through the technologies. Basically, in the mid-90s is when authors like Kimberly Young, Mark Griffith were starting to talk about internet addiction, computer addiction in England, in the US, and in less than 10 years around the world, all type of researchers, clinicians, academics were starting to publish works related to internet addiction, problematic mobile phone use, gaming addiction, etc. But has been now in this decade, in concrete between 2013 and 2018, that one of these specific internet addiction problems has been recognized by health organizations, by the APA, American Psychiatric Association, as a potential mental disorder, and above all by the World Health Organization in 2018, last year, with the gaming addiction or gaming disorder as they have coined it in their ICD-11 manual. Some authors here below are explaining that this kind of behavioral addictions are basically problematic behaviors through these technologies, that people usually show patterns of real problems when they are presenting the problematic for more than 1 year, together with functional impairment and distress. In other words, when it's affecting one area of their lives, their works, studies, family, or other relationships, and this is accompanied with bad stress, together with usually other comorbidities. However, these authors are also telling that for defining an internet addiction problem, we need to take care that there are exclusive criteria. Like, for example, we cannot tell that someone gaming excessively is a gaming addict, because we know nowadays that above all young males that are competing in gaming international competitions are professionals. It's their profession, they win their salaries and their money through this activity. Then we need to take care of this kind of issues before moving. Only to let you know that these other criteria that they published in 2016 are coming from previous works, because they did a very good review. This scale is one of the ones that has summarized the most important test that we have had in mobile phone, which was the mobile phone problematic user scale from Bianchi and Phillips 2005, then 10 years before, and they did the adaptation as Paul Likowski did with the test from Kimberly Young. This is very important to understand that these scales based on criteria finally are above all used to extract prevalence, which means the quantities of people, quantity of persons that seems to have the internet addiction or the mobile phone addiction. And here we have a wonderful work by these Chinese authors, Cheng and Li, in 2014. They did a meta-analysis about internet addiction prevalence around the world, and in concrete around 31 countries. And they found that 6% of the human population seems to present potentially internet addiction problems, above all in the Middle East and less in North and Western Europe, and known in South America, probably because there are almost no countries, only a few. Look, for example, Colombia here. Same kind of work, maybe not so synthesized, but a good review that other good Spanish researchers did in 2012, Pedrero Pérez, Rodríguez Monge, Ruiz Sánchez de León, is showing us the prevalence of mobile phone addiction. And we can see that, for example, the first Spanish work was finding almost 40% of a Spanish population with mobile phone dependency, while if you see the more recent works, here they finish around 2011 with this Japanese student study. They found that the prevalence was lower, around 3% for males and 5% per women. Why this difference of prevalences from 40% to 3%? Is not only explained because of the country, or because of the year. It's also explained because of the type of questionnaire. Here is an ad hoc questionnaire. Here is a validated scale. We can rely more in validated scales. Usually the percentages are lower and are more reliable. However, these are the kind of things that usually happens when you review other works or you compare and try to do meta-analysis of works. Moreover, let's move to something more recent and important nowadays regarding these internet addiction problems, independently of if it's by a computer, a mobile phone, a console, or any other technology. Recently, the World Health Organization last year recognized gaming disorder in the International Classification of Diseases that they published, which is known as ICD. And basically what they did was a work as what the APA, the American Psychiatric Association, did a few years before with the internet gaming disorder. That was to define what is this specific addiction problem with gaming, and to start telling what are the inclusions and exclusions to help to diagnose this health problem. Then the WHO told us if someone is presenting an excessive and problematic pattern when gaming, independently if it's online or not, and this pattern is present in the person during more than 1 year, together with loss of control, salience, and increasing problems that are causing functional impairment and distress and are not considered hazardous gaming or bipolar disorder, then you can diagnose gaming disorder. This is a different proposal compared with the one that we had in 2013, thanks to the APA in the DCM-5, another very well-known manual for mental health disorders. They were telling us similar things, but they were following the type of strategy that Kimberly Young was also using, which is the typical strategy from the DCMs, to give a set of criteria and tell us the cutoff. For example, 5 out of 9 of these criteria, if are present for more than 1 year in a gamer, this could help us to consider this gamer a gaming addict. But they restricted initially these kind of problems to the online games for one reason, because almost all the publications and empirical works done about video game addiction are based on online gaming. Then, before this kind of recognition, the one that has been really important, which is the one that I was explaining you with the ICD-11 and World Health Organization, there was and there is still a lot of debates with cons and pros for considering gaming addiction a mental or health problem. And basically I can tell you that even considering that both parts of the debate were telling us good reasons to not considering or considering it, exists international consensus in that in realizing that this is a problem. But this is a problem for a few gamers. And still we don't know much yet. We have quite a lot of quantitative evidence, but not much qualitative evidence yet, and not much clinical evidence. We have studies from around the world, but above all from specific countries and continents and not others, and basically based in psychometric studies, which means studies through questionnaires like the ones that I showed you with prevalences. However, the World Health Organization took the cautious principle as a reason to consider gaming disorder as a health problem, which could be summarized through this quote: uncertainty should not postpone preventive measures. In other words, it's better to prevent than cure. than to cure. For the reason they were telling to the international community, we are recognizing gaming disorder to give formality and international recognition to this problem in order to facilitate the quick short of information about how to deal with these patients, to also give recognition to the problem and advice to the governments and organizations to provide funding to support these gamers and their families to be treated and just to prevent in a public health environment that this could be a bigger problem than it is at present. Then what we know nowadays is that we have quite a lot of instruments for measuring gaming addiction, more than 20 scales measuring quite a lot of different criteria and symptoms in several languages, and above all related with online gaming and specific genres like the massively role online games like the Morph, the mobile, etc. And also we have good research, above all reviews and meta-analysis like this one done by Jia Yun Pham in 2018 that are starting to show us the picture, telling us with caution. Nowadays, we have probably around a 5% of internet gaming disorder around the world that has studied the problem, with males being more affected than females. But, well, we need to take care because the methodology and the processes used for extracting this kind of data are very variable, and there are a lot of aspects that still revision. However, as the patients are going to the clinical centers and hospitals to ask for help, for diagnosis and treatment, we can tell you nowadays that there are quite a lot. This is a work done by Sussman and colleagues recently, and basically they were telling us what we know, but very clearly. We have quite a lot of not only questionnaires and tests, protocols and information about how to do interviews and knowledge with red flags, which means risk factors. For example, academic decline, sleep disruption, changes in real life activities or relationships, etc. to start diagnosing properly a patient with gaming addiction. This patient usually is an adolescent with their parents or a young adult, and the diagnosis is a dual diagnosis because apart of this addiction problem, they have other mental health problems like depression, anxiety, stress, social phobia, hostility, and other even more severe problems. However, good news, treatments are working well. In concrete, the cognitive behavioral therapy, CBT, and other eclectic approaches, like the systematic approach when the family is included in the treatment, are showing very good results few months of treatment. We know this because we did a study last year that has been published now for the European Parliament, looking at this kind of problems in concrete gaming and the gamer profile. And we discovered that gaming problems usually appear in the high school, affect males who play role-playing games, who spend a lot of time at home alone, and the parents are the ones who realize, thanks usually to others, about the problem and bring the adolescents or young adults to the health centers for treatment. The addiction symptomatology is quite different regarding internet addiction and other addiction problems. There are specific comorbidities. Patients tend to have also problems with their social relationships and also with their parents, sometimes with the parenting styles. However, as I was telling you, CBT is showing very positive results in less than 3 months that are maintained if all goes well in 6 months or more. And then the prognosis is quite positive, above all if other significant people are included in the treatment. And I'm not talking only about parents, could be also the partners or the siblings, etc. Then, just to show you, we are moving research to specific groups like women, because women, female gamers, are nowadays, and this is a surprise for a lot of people, half of the gamers around the world. And the world for us in these studies are basically America and Europe, but this is probably happening also in Asia and other continents. And what we know is that if women are half of the users of these games, online games above all, are they developing the problem of internet addiction? What we are discovering is that fortunately not. Fortunately, it seems that women, of course, a few of them develop the addiction problem, but the majority not. Is still something affecting more to males in comparison with women. And now we have also the concern about what is happening with children, because they are the ones who are playing the video games. And current research is looking for evidence to see if these young age groups can also develop or not, and how this kind of addiction problem. And for the reason, there are quite a lot of public health initiatives and prevention policies that have been undertaken in Europe and above all in Asia and other countries in other continents. And a lot of actions are coming not only from the governments, also from non-government organizations and gaming companies. Look, for example, in Europe we have the PEGI, the Pan-European Game Information, which is some stamps that the industry is including in the games to alert about the contents or the risks of the games. But still, much more is needed to avoid that. Above all, the younger ones or the most vulnerable ones will develop this kind of problems. And just to finish, only to let you know that in IJERP, the International Journal of Environmental Research and Public Health, we have opened a special issue about this kind of internet use-related addiction problems, in order to peer review and publish all type of papers from everywhere with this kind of topics or collateral topics. I'm telling you this because we are happy to be in touch with you. In order that you can send us, if you want, your ideas with an abstract, just to help you if this idea fit well with the special issue, to maybe publish it with us. And anyway, I hope you have enjoyed this first keynote video lecture. It was just to let you know about this kind of global health concern, which is affecting at a public health level everywhere. I wanted to let you know what are the findings that we know nowadays, to share it with you. I hope that you have enjoyed. I will be very happy to be in touch with you through the conference, and thank you very much for listening it, and I hope that has been helpful, and happy to be in touch with you. We will be happy to be in touch with you for any consideration. Enjoy the conference, and good luck. Bye.